The naked truth is always better than the best dressed lie because the truth proves itself with the passage of time always. So, causes of the cons are friction and pressure from the repeated actions, and these are because of number one, wearing ill fitting shoes and the socks. Tight shoes and the high heels can squeeze areas of the feet. If shoes are loose, foot repeatedly slide and rub against shoes. Foot may also rub against a seam or stitch inside the shoe. Socks that does not fit right can also be a problem. Number two, skipping socks, wearing shoes and sandals without socks can cause friction on the feet. Number three, playing instruments or using hand tools. This causes repeated pressure or even a pen can cause it. You use it repeatedly for writing. Number four, inheriting tendency to develop corn. Some people do have this. It occurs on the non-weight bearing areas like soles and the palms that is called keratosis punctata and that have got the inherited tendency caused by the genetics. Here one can see the keratosis punctata. Signs and the symptoms of the calluses and the corns are a thick, rough area of the skin, a hardened, raised bump, tenderness on the pain under skin, flaky, dry or the waxy skin. The hard part at the center of the corn resembles a barley corn or the shoe track, a cone or the funnel shaped, as I have shown you in the previous slides, with a broad top and a pointed tip at the bottom. Because of the shape, corns intensify pressure at the tip and cause deep tissue damage and ulceration. Corns interfere with the walking and lead to the lack of movement and exercise. Here again you can see the corn, the cut section and the funnel shape of corn. Hard corn cause problem in insensitive skin due to the damaged nerve. That is in case of the diabetics, they more readily become infected and potentially lead to the gangrene. Location of the soft corn differ from that of the hard corn. Hard corn occur on the dry, flat surface of the skin. Soft corn between the toes stay moist to keep the surrounding skin. The corn center is not soft but indurated. So the complication of the corn, especially in case of the diabetes, are the poor blood flow to the feet. There is a greater risk of the complication from the calluses and the corn. Diabetic people, they have got affect their capillaries that supply the skin. Thickening of the skin with the callus cause difficulty of supplying nutrients to the skin. So callus with the absent foot pulses and formation of the hammer toe, there is increased risk for the foot ulcers. Diabetic foot infections are leading cause of the diabetic limb amputation. Here one can see the blood supply, the blood vessels are narrowed of the foot of the diabetic people, and one can see the diabetic foot syndrome, the injury that can lead to the gangrene ultimately and ultimately blackening of the part, and the amputation is just inevitable here. The stiffness of the callus of the corn plus shear and the pressure that caused it tear capillaries or the adjoining tissue, causing bleeding within callus of the corn. Often bleeding with the callus is an early sign of the diabetes, and this can even before elevated blood sugars can be noticed. Bleeding is small, sometimes hematoma are formed, and diagnosis how you are going to have that is the physical examination rule out the other causes of the thickened skin, such as warts and the cyst. Confirm the diagnosis by trimming away a bit of the hardened skin, or in other words, you can say skin biopsy. If it bleeds or reveals black points, dried blood, it is a wart, not a cord, because the wart gives this kind of appearance. Imaging studies to detect any underlying bony deformity. A plain radiograph is sufficient sometimes. CT scan is sometimes used. Here it is as with the stripes, zebra. So this has led to the zebra crossing. Now the treatment of calluses and cords is same, avoiding repetitive action that caused them to form, so they remove the source of the friction or the pressure that makes calluses and cord. So these will disappear automatically. Wearing shoes that fit and using protective pads can also help. If a callus or the cord persists or becomes painful, do have some medical treatment, and treatment is done if there is a pain or the cosmetic reason, so one can go for the medical treatment. Now, what are the different treatment? Trimming away the excess skin, cut down thickened skin or the trim a large cord with a scalpel. Then medicated patches are used, which are keratolytic in nature, that contain 40% salicylic acid. Try thinning thickened skin with a pumice stone, nail file or the emery board. Then you can just apply this keratolytic agent, salicylic acid. Before applying a new patch, just use the pumice stone again. For larger area, use salicylic acid in gel or soft paraffin, corn plaster, a felt ring with the core of the salicylic acid that relieves pressure and erodes hard skin. So here one can see the salicylic ointment on the cord removal plaster, which contains the salicylic acid, and it is used just like the saniplast or the plasters. So it just the medicine is put on the affected area. Then shoe inserts. If one have an underlying foot deformity, use custom-made padded shoes inserts, orthotics or footwear with extra toe space, and to prevent recurring corns and the calluses, correct the gait abnormalities, and surgery if everything fails, to correct alignment of the bone causing friction, callus shaver, and sometime it is done the wedge section, the area which contains the cord on the callus. One can have the wedge section and removal of that area is removed, and then a stitch is placed for the area, and one can use the best inserts for the shoes also. Lifestyle and home remedies. Treat diabetes or another condition that cause poor blood flow. Soak hands or the feet. Soaking corns and the calluses in warm soapy water softens them. This makes easier to remove thickened skin of the calluses. Thin thickened skin once softened. Affected skin, rub corn on the callus with a pumice stone, but not in case of the diabetes. One can use nail file, emery board or the washcloth also to remove a layer of the toughened skin. So wet the foot, use the pumice stone, nail file or other emery board just to make soft the, and do not use a sharp object to trim the skin. Use the corn pads, applies a donut shaped foam pad to protect area where callus or corn form. Be careful, these contain salicylic acid, which can irritate healthy skin and lead to the infection, especially in the diabetes. So to protect the healthy skin, apply apply the petroleum jelly to the area around the core or the callus to avoid the irritation because of the salicylic acid. Moisture the skins of the hands and feet regularly. Use cord cushions, cord removal pads, then moisturizing creams and the petroleum jelly to protect the areas. Can you think of that beautiful building designed by an architect and how it is just standing, the base unbelievable. So the prevention continued. Calluses and corns are easier to prevent than to treat. To avoid minimize rubbing and the pressure will prevent callus formation. Use protective coverings, wear felt pads, non-medicated corn pads or the bandages over the area that rub against footwear. Try toe separator or some lamb's wool between the toes. Wear padded gloves when using the hand tools, or try padding tool handles with the cloth tape or covers. So here one can use the felt sheet, corn pads, the best gloves, and the toe separator. These are all for the prevention of the calluses and corn. Wear shoes that give toes plenty of the room. If one cannot wiggle toes, means shoes are not too tight for your feet. Get stretch shoes at any point that rubs or punches. Shop for the shoes when the feet are most swollen. At the end of the day, if one use orthotics and inserts, have them on the while fitting shoes at the store. People with a poor circulation or sensation should check their skin and get it checked by the doctor for signs of the rubbing and irritation to minimize any damage. So here one can see the orthotic insoles and check whether your shoes have plenty of space and this is not good and this is the fit for your now society and the culture. Calluses in the hands are associated with the manual labor and the blue-collar workers. During the Gad's Hill train robbery in 1874, James Younger gang, a film, spared the robbing men with callous hand, considering them to be working class laborers. Calluses developed on the forehead from the frequent prostration required in the Muslim prayers called prayer bump or zabiba. Such calluses are considered marks of the piety in Muslim countries, the mark of the poisonous and considering to be a noble man, bump or zabiba, and that is the Jesse Aim, the train robbery film, and that he spared the people, those who are having the calluses on their hand. People take special steps such as the praying on the straw mats, especially the Muslims, to encourage callus to develop. Calluses form on the fingertips from the repeated pressure and friction of the playing string instruments like guitar and others. Here calluses allow player to repeatedly depress strings without causing pain, so the callus formation is viewed as something special for beginner string players. And here one can see the Muslim prostration causing zabiba on their forehead and the guitar calluses because of using these guitar wires. And that is the end of the lecture, and I request and hope that you are going to subscribe and like this lecture, and you are going to tell others also. And if you have any question or any objection regarding this, you can call me at my number. I will not hesitate to answer.